these young athletes perform vigorously?
Well, it can be caused by several different congenital or diseases that people are born with. One of them is thickening of the heart. Another is where the heart is the muscles replaced by some fatty tissue, and that can leave the heart susceptible to deadly heart rhythms.
Is there any way to know in advance that you're at risk, that your child might be at risk for this?
It's very difficult. The best thing to do is to identify patients who have a family history of someone, a first-degree or second-degree family relative that has died suddenly. From there, we try to find symptoms of rapid heartbeats or chest pain or passing out in that patient themselves.
Are there any warning signs, or is there something that a physical might determine when these athletes have to undergo their physicals each year?
It's very difficult. Usually the physical exam is normal. If there's any suspicion, we can go beyond that and get a simple test to try to figure this out.
Now, we should talk about defibrillators and the need for defibrillators in places where athletes work out. What should schools, gymnasiums, coaches, fellow teammates be doing to learn about and to have defibrillators accessible?
Sure. I think the key thing is to recognize that when an athlete collapses suddenly, we should treat that patient as if they're an adult and do the same things we would do with an adult, including recognizing, finding an external defibrillator and using it promptly, even on young people.
Okay, well, Dr. Katsianis, thank you so much for helping explain this very critical concern of young athletes. Appreciate it very much. Well, Wendy's hopes a free treat will get you eating their food again, what you can gobble down this weekend without spending a penny coming up. Are fuming this morning.
The cockpit of the DC-9 ran into the wing of the A320, and it peeled back the cockpit 6 to 8 feet into the DC-9, about 3 feet down into the cockpit. It just kind of peeled back.
Now, 6 people were injured in the crash, all of them Northwest employees. 4 of those were on the plane. None of the injuries appears to be life-threatening. Northwest says that crash did not affect other air traffic. A St. Paul